Welcome back, everybody. Now to a tough but very important conversation about pets. Have you ever thought about the end-of-life care for the special pet in your life? Well, Lap of Love is an organization that helps pet owners navigate that last stage of your pet's life, which can be extremely difficult, but a super important topic. So I am joined this morning by two Lap of Love consultants, Dr. Miranda Shaw to my left and Dr. Amy Myers to her left. So good morning to the both of you. I'm so happy to see you, so happy you're here. So we want to talk about, you often think about hospice for humans, but I don't know if the topic of hospice is discussed so openly when it comes to your loved ones, and that is your four-legged friends, right? Yeah. So talk to us about this idea of end-of-life care for your pets.
I think, the biggest thing, one of the biggest philosophies for Lap of Love is that human-animal bond and making sure that that connection is maintained from the very start of life all the way to the very end of life. And like you said, it's not something that we often discuss until it needs to be discussed. And so really the main thing is making sure that we maintain an adequate quality of life, a good quality of life for our pets for as long as possible. And then when that time comes where we need to start making those end-of-life decisions, that you have guidance from someone who understands the disease process, who understands what's next for the pet, and who can make sure that up until that very final moment, we're doing everything in our power to make sure that that pet is comfortable.
And if I may interrupt, so Dr. Amy, I want to talk about what that means. Like, what does that mean? Like, I can process the information, right? But what does hospice care look like for my dog?
Absolutely. So we are an in-home service. We take everything out of the veterinary hospital and we actually physically go to the home. That makes such a world of difference when we're talking about determining the quality of life for a pet, because only in their home do they feel the safest and most secure.
Just like a patient would,
Absolutely.
right?
So they behave normally at home, they're comfortable at home, and it really is about honoring the family wishes and the pet preferences. And so I just wanted to touch base and share, we go to the home where we can have those astute observations of the pet, a very good conversation, and plenty of room with the time and space to devote to that family and that pet.
We do have Sugar in our studio this morning with Colleen, and Sugar, I mean, look, just the sweetest, has not made a peep, honest to goodness, has not made a peep, is just relaxing and chilling out, going through whatever Sugar is going through. But she's an example of a dog that is in your care, right? So what is the kind of attention that she is getting right now on her journey to the next stage?
Well, Sugar is on more of a holistic treatment plan. Yeah, so her biggest thing is what we call canine cognitive decline, or it's something we call like doggy dementia. So she may get confused, she may have some pacing behavior, she may have difficulty resting peacefully at night. So there are supplements that we can give to help manage her anxiety. She's a bit incontinent, like we said, she is an old lady, so we manage that with diapers and keeping her clean, and her mother Colleen provides excellent round-the-clock care for her to make sure that she stays clean and comfortable. Fortunately for her, she's not in excessive amounts of pain. So, we don't have her on any anti-inflammatories or anything like that right now. But as her symptoms progress, as she ages, we can constantly manage her care plan, add in new things, take away new things as we see fit to keep her as comfortable as we can.
And Dr. Amy, how does, for people that are watching this and maybe they do have a pet that they know the journey is maybe not coming to an end tomorrow, but they're getting there. Yes. How do you make that tough decision? Like, you know what, maybe hospice is the next call I need to make?
Absolutely. So it's interesting, if I go to a home, oftentimes it's for the end of life care. So those moments like Sugar, when I can come into the home 4 months ago and say, today's not the day. It's a rare treat, but I got to do that with Sugar and she's still with us. When we go into the home, we're really looking at evaluating the proper window for us to intervene after hospice has started. So we determine these lines in the sand for every pet and every family. And that is what they use objectively, that if their pet crosses that line, then we know we may have to swing from hospice into end-of-life care.
Dr. Miranda, Dr. Amy, thank you so very much for being here. Colleen and Sugar, thank you so very much. It's not an easy decision to make, but look, if you can get some more time, sometimes that's all you need to end it properly in the best way you think is proper. We're going to have more after this break. Stay with us.
Eyewitness News streaming at 7.